So for this section on advanced pelvic analysis, it's very important to realize that how this LITEFORCE technique works is it uses the innate movements of the body. So when I say lift the leg up, this is what happens. Lifting the leg up causes this innominate bone to go into flexion. And then when I say push your knee down, it goes into extension. So knee up, knee down, knee up, knee down. So when the knee is up, we want to move it in this direction. So we put our force here, just like a teeter-totter. So knee up, knee down, knee up, knee down. And the same thing occurs with the sacrum. Knee up, knee down, knee up, knee down. And these are the spots you're going to use to mobilize the innominate or hip bone and the sacrum in what we call flexion or flexion and extension. When working on the pelvis, you can work with your table at regular massage table height. I prefer to have a little lower. So for a lot of this work, you can have it at normal massage table height. I lower it just a couple inches lower when I want to do the pelvis, about there. So remember that when she brings her knee up, the hip bone moves into flexion, and then when she pushes her leg down, it goes into extension. So it's knee up, knee down, knee up, knee down. That's the teeter-totter we were talking about. The same thing is true of the sacrum. The sacrum is here, knee up, knee down, knee up, knee down. So I position Julia, come about an inch closer, good. So her knee is just between my legs, and I say, bring your knee up towards your chest against my leg, good, and then push it down against my leg, okay? So when she brings it up, the pelvis moves posteriorly or into flexion. So if I want to move it that way, I come here to the ischial tuberosity. So knee up and knee down, and knee up and knee down. And if I think it's an anterior innominate, I may use two hands. Knee up, knee down, knee up, knee down. That's so I can move it more posteriorly. And the same thing is true of the sacrum, except that usually the sacrum is also anterior on the right. So I'm going to stick mostly to the left side of the sacrum and the inferior part of the sacrum. So I'm going to get on the inferior part of the sacrum now. Knee up, and when I say knee down, I push on the pelvis. And knee up, I go to the sacrum, and knee down, I go to the pelvis. And knee up, and now I'm on the pelvis or hip bone. And that's how you move the innominate or hip bone and the sacrum into flexion and extension.